Good morning. My name is Valerie Leonard. I am the founder of Nonprofit Utopia. I want to say thank you so much for joining us today. If you've been following along and if you're a member of the Nonprofit Utopia community, you know that all this month we're focusing on performance management. We're showing you how to manage your organizations and keep track of certain indicators that let you know that you are reaching your performance goals, either as it relates to operations or your program management. Today, we're going to be focusing on evaluation planning. Before we get started, just want to let you in on a story that lets you know why I'm so passionate about evaluation planning. I can remember a time when I was running a nonprofit organization in my community, and I know beyond a shadow of a doubt, and in my heart of hearts, the work that we were doing was awesome and it was making an impact. In fact, our funder was bragging about the work that we were doing in their own circles, right? But this same funder asked us to do an evaluation of our programs and services, and we actually came up short. Why did we come out short? We didn't design our program in such a way that we were collecting data, right? And the data that can prove that we were actually doing the work that we said that we were doing. So as a result, we had to rely on pretty pictures and wonderful feel good stories. And I can assure you that was not the most comfortable position to be in, especially since we knew that the work that we were doing was valuable work and it was making a difference. The problem was we weren't tracking our outcomes and we didn't have the mechanisms to do so. So ever since that day, I said never again, and I won't let my clients make that same mistake either. All right, so at this point, I am going to share my screen and we will get into our presentation. So if you can just bear with me just a moment, we will get into our presentation. If you have any questions, if you have any comments, please feel free to share. If you have any experience on your own with evaluation, some of the experiences you may have had either evaluating your programs or having your programs evaluated, we would love to hear from you. If you're just stopping through, please take the time to let us know who you are, where you're from, and all of that good stuff. So without further ado, we're going to be talking about evaluation planning for nonprofits. And in order to do that, we're going to have to step back a few steps just to show you how you can even get to the point of planning, because it makes no sense to do planning without having proper context. All right. So we got a lot to cover. We're going to talk about what a program evaluation is, why they're important. We'll talk about the evaluation process. We'll talk about the relationship between the theory of change, program development, and your program logic model, as well as the evaluation process, right? And how you can use that evaluation process not only for marketing, but for managing and all that good stuff. And then we'll get into evaluation planning. And again, it's important that you understand the context and what you can do with evaluation before you do the plan, so you can make sure that when you do your evaluation plan actually gives you the maximum results and you're not sitting around or not running around, shall I say. You're not running around scrambling. All right. So when we talk about program evaluation, in a nutshell, that's basically seeing if your program is doing what you thought it would do. You can look at it operationally as well as in terms of outcome. All right, so it's a systematic method for collecting the data, analyzing the data, and using it to answer basic questions about your projects, your programs, services, and your policies. And depending on what type of evaluation is, usually you're looking to see the impact of your programs and services on the people that you serve. You want to make sure that the work that you're doing is actually making a positive difference in the lives of the people that you're serving. So one of the most common types of evaluations is the process evaluation, or in some circles we call it the formative evaluation. This evaluation is usually done, toward the first 2 or 3 months of a program, just to make sure that everything is up and running the way you intended. And the reason it's important that your program runs as intended, you want to make sure that even though you're just checking for operations, and when I say operations, I'm talking about nuts and bolts activities. Are the activities starting on time? Are you serving the number of people? Um, and all of that stuff. Are you delivering your content in a way that you thought you would? That's important stuff so that you can actually engage in activities that are going to change the lives of your people. So if you don't have mechanisms in place to make sure that the program that you have is running smoothly, the chances of your collecting the data to at the end find out whether or not it worked are very, very nil. And it's important too that when you design the program, that you design it in such a way that you do have goals and objectives and outcomes. And we'll talk about that, right? So your process evaluation is going to be looking at things like, when your activities occur, where they occur, how they're delivered, who delivered them, and, again, are we doing what we said we were going to do from an operational standpoint, right? So you're looking at this to see if there are opportunities for you to actually cut some steps in the process, make it more streamlined, be able to save money. But it's important too that whatever cuts and streamlines you make, you don't cut quality, right? But the overall goal for these evaluations, again, is to make sure the program runs at, um, as intended, and you want to make sure that you remove any duplication and improve efficiencies. Another common type of evaluation is your outcome evaluation. And this evaluation focuses on results. It focuses on whether or not you actually made the changes to the people that you intended to make. The only time you're not focusing on your clients or the community is when you're evaluating a process that was meant to improve your internal operations as part of capacity building. But generally speaking, when we're talking about outcome evaluation, we're looking at the changes to the people in our programs. So usually when we talk about outcomes or results, we're looking at short-term results, intermediate results, and long-term results. And for an example, in an exercise program, a short-term outcome could be a change in knowledge about the health effects of exercise, or it could be a change in our behavior. A long-term outcome would be less likelihood of dying from heart disease. And somewhere in the middle, we'll be looking at things like, is there a change in blood pressure? Is there a change in blood sugar? Is there a change in our heart rate? Okay, and our outcome evaluations or the summative evaluation, and that name is just as it implies, it's the sum, what is the sum total effect of our activities? So we're using it to measure the programmatic impact on our clients and community, to make recommendations for improvements, to determine the feasibility of ongoing programs, and whether or not you want to continue to put the money behind those programs. Should you tweak the program to serve more people, to serve different people, or just discontinue the program altogether? All right. So when we look at the why we should conduct the program evaluation, we want to look at ways that we can continuously improve the quality of the program, right? We also want to develop criteria to determine whether or not to continue the programs, as I indicated before. You want to be able to demonstrate and have the evidence, right, that your program is working. And when I say evidence, yes, it's wonderful to have those wonderful stories, those qualitative indicators that your program is successful, but you also want to be able to marry that with the good hard data to suggest, what the true impact is, or rather, not even just suggest, to even support your assertion that the program is in fact working. It's also a good tool, a good way to communicate program success to the community, your clients, potential partners and funders and current funders, right? And in some cases, depending on what your program or service is, for example, if you're a hospital or a rehab center, or if you're dealing with mental health issues, typically you're going, and even for education, you'll need those evaluations for accreditation, and those are very, very rigorous, and you'll also need them for funding. And in terms of rigor and whether or not you need to have some scientific process, if you take some of the lessons learned from this video, we can show you ways that you can evaluate your programs internally without having to pay someone. But it's always best to have, if you can find the funds, to have someone from the outside to come and evaluate your programs so that you have an objective eye and it'll be taken a little bit more seriously. But, bottom line is you want to know that what you're doing is working, right? So there are a number of people who care about what you do and whether or not it's working, right? So these would be your funders. They can make funding decisions. They could decide whether or not to continue to fund you, whether or not to expand their funding of your programs. They can determine whether or not the programs are effective, and then use some of the lessons that they learned from you and your organization to share with other people that they know. And then that positions your organization to then become a thought leader on a certain topic, right? They're also interested in knowing whether or not you met your goals, whether or not you met your outcomes and your objectives and all of that good stuff. And your board of directors, too. Remember, they are ultimately responsible for governance and everything that happens in that organization. So as they evaluate what's going on in the organization and exercise good stewardship, that means the good use of the money, right, to make an impact, they're going to be concerned about whether or not your programs are evaluated, and if so, what the outcomes of those evaluation results are. And again, that is consistent with their fiduciary responsibility of care. Your program managers, they obviously care about the outcome so that they can improve the programs and services. And then they can also market the programs more effectively. They can use it to make management decisions, and again, to market your programs and services, and again, to position the organization as thought leaders in a particular area. Your existing clients, your potential clients, they want to understand too what the quality of your programs are. And never get so comfortable and think that just because people are not paying for your services that you don't need them, that they're not effective consumers. Because if they don't come through your doors, that makes you irrelevant, right? So it's very important that the potential clients and existing clients like your services too. They could become, great word of mouth, but most importantly, you are making an impact on their lives. All right. Um, Other people who care about what we do are community stakeholders, right? Community stakeholders could be other community groups, it could be residents. They want to know if you're good neighbors, right? If you're not doing right by your clients, that means you're not doing right by their neighbors, right? So it's very, very important that you be able to communicate your success and maintain relationships with people who live in the community, who work in the community, and who worship in the community. You also want to make sure that potential individual donors know and understand the work that you do and the impact that you're having so that they can decide whether or not to give to you. And then other organizations, you want to make sure that you can share your knowledge so that you can lift up the practices across the nonprofit sector. Okay, so you want to really put yourself in the end user shoes, and the end user could be various audience segments. We could have program management and staff, participants, community members, public officials, residents, and funders. So depending on who the audience is, they're going to use the evaluation results differently, and they're going to have different questions, right? Ideally, you want to be able to answer these types of questions, but in the event that your resources and time are limited, you want to focus your questions to satisfy, I guess, whoever is ultimately responsible for the results, which would be your board, staff, and funders and clients. But these other audiences will have questions as well. So when it comes to program management and staff questions you might want to ask, and these are important because these begin to help you shape your evaluation. And most importantly, you want to shape your program such that you're answering these questions, such that you're collecting the data to prove that you have the answers one way or the other, and you can then have the data that you have not only on the implementation side, but also on the program evaluation side. So, questions program management staff would have: are we reaching our target population? Are our participants satisfied with our program? Is the program being run efficiently, and how can we improve our program? And the data that you collect will help you to answer those questions. And when it comes to the evaluation use of the answers, those answers are going to help you strengthen the program, make decisions, better decisions, and improve the program on a day-to-day basis. The participants may um, have questions like: did the program help me and people like me? What would improve the program next time? And in some cases, very subconsciously, it will help them to determine whether or not they want to come through your doors again, right? So, for evaluation purposes, when they evaluate, they're going to be making the determination whether or not to use your services, whether or not they should tell others about your service, right? Community members, they're going to be asking the questions: is the program suited to our community needs? What is the program really accomplishing? You know, are they actually harming people? And they will use this information to decide whether or not they're going to support you and throw their goodwill behind you. Public officials, the questions they'll be asking: who is the program servicing? What difference has the program made in my district? Is the program reaching the target population? What do participants think about the program? Is the program worth the cost? And even in the back of their minds, they want to know, how can they use the information from your evaluation or even from your results that you're dealing with for the people to shape legislation and policy so that they can expand the impact. And then when you have really strong relationships with your elected officials, they'll be looking at ways they can actually bring money back to the district based on what your evaluation is saying. So they're going to use the information to make decisions about whether or not they support your organization. Um, and it doesn't necessarily have to be financially, but the worst thing you want to do is run afoul of an elected official so that they're bad mouthing your project and you don't get any money. And And I've seen good programs be derailed because some elected official didn't like them, right? So you want to make sure that you can not only answer these questions, but you want to make sure too that you spread the message abroad to their constituents. So if you find yourself in a position where they don't like you, you have enough support from the community to demand support for your programs. They'll also be looking, and when I say they, I'm still talking about public officials, they'll be looking for knowledge about the utility and feasibility of the program approach. They want to use this information to talk to other lawmakers, to other policy makers who are designing programs and services to make sure that those programs and services are actually useful to people who are accessing the services. And then funders. Funders want to know, was the promised result achieved, right? Is the program working? Is the program worth the cost, right? So they're going to be looking at the cost per person, and then they'll look at the impact you're making and looking at the cost per person to make that impact. And they'll be probably comparing that same cost per person that's impacted to others. And then they will make comparison between your organization and others and decide who should get money. So, for their evaluation purposes, they're going to be looking for accountability and improvement in other grant making. All right, so it starts with the community. As I mentioned before, everything starts with the community. And even before you do your theory of change, you need to really understand what's going on in the community. What are the issues of the community? Who is being impacted either positively or negatively in the community? Who is already doing similar work in the community? What's the quality of the services of that organization or of those organizations? And even with all the work that's being done, right, we're still going to see some problems that need to be addressed. So at that point, we need to not only do a community needs assessment that determines the needs of the people and not only what they need, right? Not only what they need, who's out there serving them and the quality of their services, but understanding the gaps in the services, right? Um, Given, you could still live in a community that has over 100 organizations and there still are some unmet needs. And even beyond the unmet needs, you want to be able to tap into pent up demand. Just because you build it doesn't mean that they will come. So after you do that community needs assessment, focusing on the demand side, right? Focusing on what people already have to heal themselves and looking at all the positive things in the community that can be used, what we call assets that can be used to solve the problem, then we want to develop our theory of change. Our theory of change is planned social change. We know that there's always going to be social change for the better or for the worse over time, but we want to look at ways that we can actually control some of that change, harness that, make lives better in our community. So we're going to develop a map showing some of the relationships and the cause and effects of some of the issues and figure out ways that we can develop interventions that are actually going to be proven to make a positive difference. Then we're going to establish a blueprint for that work. We're going to establish some of the likely effects. And then we're going to also talk about what should be evaluated, when and how, and by whom. And if you were with me before, you may recognize this map. This is a map, and this is only one way you can do it. For every map there's out there, there's probably a million other ways that you can approach this. So this is not the only way. This is one of millions of ways you can map out your theory of change. Um, this theory of change assumes that you've already done the work in the community, you've already identified the issues, right? And you have developed your mission, your whole reason for being, your why for doing the work that you do based on what's going on in the community. You have certain assumptions that you make about the problems and the way that you might approach them, and then you identify your target. And once you identify your target, you develop a set of strategies and or programs and services, and then you reflect on the results. You know, what happened, and not only from an operational standpoint, but from an outcomes perspective. Look at what has changed as a direct result of the work that you're doing. And then you use that information to go and inform your mission to see if that mission is still necessary, if it needs to change a little bit based on what information you have. And then you go through this whole continuous loop again. So it's continuous quality improvement based on the experiences that you have delivering your programs and services. So you always want to be responsive to the changes that are occurring in the community, that are occurring with your clients, and making sure you're responsive to what they need and what they want. All right. So we already talked about the community needs assessment. And ideally, as I said before, the community needs assessment would have gone before your theory of change. And it's just a way of gauging opinions, assumptions, needs, key issues, and or assets in a community. And the way we gather the information, right? We can gather information through surveys and questionnaires, to get people's opinions, to get their attitudes, to better understand what they know about certain issues, understand what they know about their own behaviors, about their own health, etc. You can use it, depending on how the survey is structured. You can use it to develop quantitative data, which is those data that can be numbered, or you can use it to gather qualitative information, which is basically information about attitudes, right, and behaviors. Your interviews would usually be one on one. You're trying to talk to people who are impacted by your services, people who might be potential partners, people who actually use your programs and services, people who are like the people that you would like to serve. And this gives you more qualitative information that you can use to get behind the information that you collect in a survey. You can collect data through literature reviews. You can look at who else out there who is doing similar work, the results that they got in their research, or just even if it's not research, they can share their experiences and the results that they have. And then you can take that information and compare it to your own experiences. You can use what they have to do an experiment, so to speak, in your own community. You can tailor it to fit your own situation. You can do an asset map, which can be a literal map of the issue, so to speak. So, for if you're doing affordable housing, you can map up where all of the affordable housing units are located in your community, and that way you can identify at a glance, where the needs are. You can do maps of health issues like heart disease and cancer to see if by any chance there might be some environmental cause for these disease. If you notice that, there's a high percentage of cancer in a certain geography, then there's a good indication that you need to do more research to see if there's some environmental factor in that location that's causing cancer. You can do focus group discussions, and focus group discussions, those are basically group interviews, and you want to make sure that the people in the group are similar, they have similar backgrounds, similar issues, and ideally they would be similar to the people that you're trying to serve so you can get into the head of your ideal target and better shape your programs and services to meet their needs. You can also use focus groups for, of people that you already serve and get a sense for what's working with your program, what needs to be improved. You can have public meetings of people in the community stakeholders who have an interest in what's going on with your program because they're somehow impacted. They could be taxpayers, they could be community residents, but you want to have a two-way street in terms of the way you're communicating with people. You want to share information with them based on your knowledge of the issues, based on your experience, based on some of your programs and services, but you also want to use that as a time to collect information from the people in the audience. You collect information through the types of questions they ask, through Q&A. You might want to use that time to actually do a survey and collect surveys. All right. So in this example, if you want to do a needs assessment for, say, prisoner reentry, some of the things you might want to consider are how many ex-offenders are returning to the community on a weekly, monthly, or annual basis. And you can get that information through public documents, through literature reviews, through people who are actually working with returning citizens. Who's impacted by their return? Family members are impacted, victims of their crimes are impacted, we in the community are impacted because of our uh, attitudes about crime, and we ourselves don't want to be victims. You want to understand what problems they face. You can get that information from talking to them directly through literature reviews, through surveys, through talking with people who work with this population. Another question you might want to consider is what do they need to successfully transition back into the mainstream as productive citizens? You can find that out by talking to them, by having literature reviews, one-on-one interviews, focus groups of people who have similar experiences as they transition from prison. Other things to consider, what services are already out there in the community, you know, and you can find that information out through asset maps, word of mouth, review of public documents, through talking to them. How well do the services work? You can find that out through surveys, interviews, focus groups. If there is some organization that actually has some report card on these groups that are working in reentry, you can use those data to determine, whether or not these services are working in the community, and that begins to help you to identify gaps in services. All right, so in order to find the gaps in services, again, you look at asset maps, interviews, surveys, and focus groups, and you look at, from that information, who's being served well and who's not being served well. And those gaps can be along certain age groups. You might find a certain age range, a certain gender that's not being served well, or you just might find that the quality of services is not there, or the number of organizations is not enough in the community to serve ex offenders. And then importantly, how can your organization fill in the gaps? And you want to do that based on the information that you've been able to gather. And then you also want to do it based on what you're able to do. What skill sets do you have on hand? How many staff do you have? in order to actually step up to the plate. And if you find that you have some gaps in your own capacity, figure out what you need to do to shore up that capacity. Does that mean you need to partner with others? Does that mean you need to hire people with that skill set? Does that mean you need to train people, etc.? And after you do that needs assessment, then you drill down and do your goals and objectives, right? So your goal, as I stated before, is the end goal, was the end toward which your program is directed. So overall, what is it that you're trying to achieve? It needs to be consistent with your mission and vision. It is outcome oriented and not process oriented. So one of the mistakes I've seen people make in terms of their goal is to develop a workforce program to address, unemployment, when that's really an objective, right? Your goal is to reduce unemployment in the community, right? That's the change that you want to see, right? So the process, right, is really an objective, right? That's the how. So your goal is going to be stated as a specific measurable outcome or change that can be reasonably expected as a result of the program or strategy. In other words, it's a SMART goal. So it's specific, measurable, achievable, it's reasonable, or in some cases relevant, right? And it's timely. You have a deadline to it. So, for example, there will be a 5% decrease in the number of freshmen who drop out of high school within the first year of the after school program. So, this is an impact and the result. Notice it has a time frame. The objective tells you how you're going to reach that goal. And you have outcome objectives and you have process objectives. So the outcome objectives are focused on change or result. The process objective tells you the nuts and bolts of how you're going to get there. But regardless of whether it's an outcome objective or a process objective, you want that objective to be SMART because you do want to give yourself some, a very firm time frame within which to do it, and you want to make sure that your results are measurable, right? And the reason why this is so important, remember when I first opened up, I told you my biggest mistake as a young executive director back in the day was having a program where we didn't have these mechanisms in place and collecting the data where we can show that we were moving toward our goals and objectives and outcomes. All right, so when an example of a good outcome objective is there will be a 5% decrease in the number of frail older adults going into convalescent homes during the first year of the social services referral program. So we're seeing that there's going to be a decrease, right? And the change is rather than going into convalescent homes, they're going to be able to age in place. So we're doing something that's changing their state so that they're not having to go into assisted living or convalescent homes, right? And then the process by which we do it, the process is actually quantifying a method. So in this example, there's going to be an increase in social service referrals. So the method is the number of referrals and the number of follow-ups. So we're going to increase that for at least 75% of people that we're serving in our Meals Consortium program between 2000 and 2001. So this shows you, it's not showing you the impact, but it's actually showing you how we're going to make the impact. Remember, the outcome is showing you the impact, the outcome objective, and the process is showing you how you're going to do it. All right, so our key indicators are those measurable units that let us know that we're making progress towards our goals, progress towards our objectives, right? Progress towards our outcomes. All right, so the key indicators are the measuring units that help us assess the progress toward a goal. And the example here is the number of frail adults or the number of referrals that we provide. All right, so the next thing you want to do is make sure that you develop a program logic model, and not just any logic model. It needs to be a strong logic model that shows a really good relationship between what's going on in the community, the goals and objectives that you're trying to achieve, the activities that you're using to meet those goals and objectives, and then the relationship between those goals and objectives and the outcomes. So, a program logic model, as I shared in our last video, is a diagram that shows the relationship between what's going on in the community, in our environment, as well as the major goals and objectives, your resources, the activities that are required, and the change that you want to see as a result of implementing the program. And as I indicated before, it can be very, very simple as, inputs, which are the resources, outputs, which are the activities, and outcomes, which are the changes. It can be that simple, or it could be several other variations that are much, much more complex. All right, so here is an example of a logic model, and this was from the W.K. Kellogg Foundation. All right, so this has resources, activities, outputs, short and long-term outcomes, and the impact. All right. So the resources tell you in order to accomplish this set of activities, you're going to need the following. So in this example, so these are all the things that you need in order to accomplish your goals and objectives, and in this case, even the activities. And then the activities are those things that you're going to use, those activities you're going to use in order to address the problem. And then the outputs are those things that you expect. Once those activities are accomplished, you're going to produce the certain results, right? So how are you actually counting them, right? So what's the production? What's the output? And then the short and long term outcomes, what's going to change in the short term, what's going to change in the long term, and then what's our impact? What are those, and what's going to be the change for people over the next 7 to 10 years? So in this example, some of the resources that are necessary were they need to have tax exempt status. They needed to have a diverse, dedicated board of directors that were representing potential partners. They needed an endorsement from Memorial Hospital in their hometown, Medical Society, and the United Way. They needed a donated clinic facility. They needed job descriptions for the board and staff. They needed funding of $150,000 and clinic equipment. Some of the activities, and I'm not going to read all of this, would include the launch and completion of a search for an executive director. They needed to have the board and staff conduct a free clinic site visit. They needed to have a board and staff complete a retreat. And some of the outputs would be the number of patients referred from ER to the clinic each year, the number of qualified patients enrolled in the clinic each year, the number of patient visits each year. So I think you kind of get where they're going with this. And over the short term, they wanted to see a memorandum of agreement for free clinic space. They wanted to see a change in patient attitudes about the need for a medical home. They wanted to see changes in the number of scheduled annual physicals and follow-ups. And, again, this would happen within the first 1 to 3 years, and then 4 to 6 years. And then the long-term impact. They Expect to see patient co-payments supply 20% of clinic operating costs, a 25% reduction in the number of uninsured ER visits a year. They want to see 300 medical volunteers serving regularly each year. Again, I'm not going to read all of that, but I think you get an idea of how that works. All right, so for this exercise, it would be great if you could try this at home. You can develop your own worksheet. And for those of you who are members of the Nonprofit Utopia community, you should have this worksheet in the community. You have resources, activities, outputs, short and long-term outcomes, as well as impact. So given what your goals and objectives are as you address some of the problems that you are dealing with, you want to be able to fill out this worksheet. Okay, so you can use the program logic model in three different phases. The first phase is the planning phase, and really that's the most important. The reason why the planning phase is the most important because we've all heard that expression, garbage in, garbage out, right? So if you don't set up your proposed program in such a way that there's a strong relationship between the activities and the outcome, and there's some way for you to measure what's going on, and some way for you to collect the data along the way, then when it comes time to evaluate, you're really going to come up short, and you really don't want to do that, right? So when we look at the Kellogg Foundation logic model, their framework, they're focusing on using the logic model as a planning tool. And first, you want to use the logic model to clarify program theory. So this is going to be used in conjunction with your program logic model. You know, some people, I'm sorry, with your theory of change. Some people like to do the theory of change first. I tend to like to do look at what's going on in the community first to inform the theory. But at any rate, you're going to develop a problem or issue statement. And the question becomes, what problem is your program attempting to solve, or what issues are you trying to address? You look at the community needs as well as their assets, and really you want to focus more on the assets. You don't want to look at people as somehow lesser because there are issues that they're dealing with, right? So, what are some of the needs in the community? But most important, what are some of the qualities that the people have that can help them solve their problems? What are some of the assets, institutions, organizations, and other people in the community that can help solve the program? I'm sorry, help solve the problem and help you design a program that's focused on assets as opposed to deficits. What are some of your desired results? So, what are the outputs? And when we look at outputs, again, those are the productivity, right? The number of units that we're trying to produce, things like number of people served, number of training sessions held, that kind of stuff, and what's going to be the outcome of all of this activity. But most importantly, over the next 7 to 10 years, what's going to be the change, the positive change for our people and community as a direct result of the work that we're doing. All right, so you want to be able to identify this work and be able to quantify it, have the data that can support it, and be able to be nimble such that if you're not moving toward your desired result, you'll be able to turn on a dime and make the adjustments, make that pivot so that you can get back on course. The next thing you want to look at are the influential factors, and those are the things that have the greatest potential to influence change. So those could be people, those could be current affairs that are happening that can really influence change. It could be a new law, it could be a new policy, it could be some devastating event, it could be some wonderful event where there's a funding windfall. But what are those things that are happening in our environment that are going to have the greatest impact on um, our clients and our ability to serve them? And then the strategies are, what are those programs? What are those things that we're going to do? And they should be in alignment with what we call best practices. And those best practices are those things that we know that work, right? And what are those things that are going to that have helped other communities that we can borrow and design our own programs, right? And then what assumptions are we going to make? So, what assumptions support your beliefs as to how and why the change strategies will work in your community? And there's going to be some experience that you've had, some data that you have that will give you comfort that what you're proposing is the right thing to do. All right. So, this chart here is basically a very similar take on the first chart that we looked at when we looked at the theory of change. So we're going to start off with the problem or issue, and this is assuming that we've already gotten our theory of change in place. We've already looked at the community, so we've identified the problem or issue, and we know that our communities have 50 million problems, right? Regardless of where we live, there are many problems. But what are the set of issues that we're going to focus on, right? And those problems should be in alignment with our skills and our capacity and our mission, first and foremost. All right. So, what are the community needs? What are the community assets? What are the desired results and outputs, right? What are the influential factors? What's going on that's beyond our control that's going to impact our ability to do this work? What are some of the strategies we're going to use? And then what are some of the assumptions that we're going to have to make because no data source is 100% complete? All right. So after we develop our program logic model, right, the next thing we do is we're going to use that model to plan our program, to design our program, and then we use that same model to implement the program, right? So that becomes how we're going to measure our progress, right? We can use that same logic model as a tool to manage our program, to see if we're on track or not, and then we can use it for our formative evaluation, right? That will let us know very early on if we are running our program smoothly, if we're running our programs in such a way that we will get the results that we desire. Remember, you had to make a bunch of assumptions along the way, right? You didn't know when you started planning your program that it was actually going to work. Once you get into the meat of running it, you'll see that there are some things you didn't anticipate. You'll see that there are other learnings that you have, and you take that information and you might need to update your logic model. So when we look at ways to demonstrate success, and this is during the implementation process, we're going to focus on the outputs, right? So we're going to look at how we're delivering our services. We're going to look at the number of units, so the number of people served, the number of training delivered, the number of meals given, et cetera, et cetera. That will depend on the type of program we have. And then we're going to look at the outcomes. So as a direct result of our activities, what has actually happened, right? What change has been made in the short run and in the intermediate term? And the impact, what has happened for our clients over the long term, where we can show that there's been some sustainable change as a direct result of our work, and usually that's within 7 to 10 years. All right, so when we look at the activities, we're going to describe each of the activities in our program, right? And then we're going to describe the resources, so those are the things that we need, the raw activity, I'm sorry, the raw resources that we need in order to actually do the activities. So the activities are going to require things like people, supplies, a location, and all of that stuff. Those are your resources. So after we run our program and we look at our activities and make sure that we're on track to meet our desired goals and objectives, we're going to actually do our evaluation, right? So the evaluation, we're going to use the same logic model. And again, the logic model, since it's going to be used also during the implementation phase, we probably at this point might have made some minor changes because at the end of the day, we want to make sure that the the program that we design is working toward the desired end, right? So we're going to start with our evaluation questions, and actually your evaluation questions should have been formulated during your planning process so that you could shape your program in such a way that you get the answers that you need on the back end. So the focus area from your program theory logic model, so from your logic model as well as your theory of change, what are the components that are the most important aspects of your program? And then you want to identify the audiences that you are trying to target. Who has an interest in your program? So your audiences are going to be your board members, your funders, people in the community. And for each focus area and audience, list the questions that they may have about your program. So if you recall this chart that we did, oh wow, I can't find the chart. Okay. So remember this chart, put yourself in the end user's shoes. This is what I'm referring to. So think about the different audiences, the questions they may have, and then how they might use um, this information to evaluate you, right? In some cases, it's going to be a formal evaluation. In other cases, it'll be less formal. So you need to have all of those questions answered, at least think about them during your planning phase, so that when you get all the way to your evaluation phase, you won't be running around like a chicken with no head like I did when I started as as an executive director. All right, so when it comes to evaluation design itself, you want to think about who your audience is. What do they care about? What do they want to know? How are they going to use the information that you provide? And remember, you don't want to go down a rabbit hole, but you want to make sure that however you structure your evaluation, it could be used by different audiences. So, how are they going to use the information? How are you going to use the information? Is the information going to be used to improve programs, for program marketing, fundraising? Will it be used to position yourself as a thought leader? You need to ask yourself what information you need to track in order to find out whether or not you have the desired outcomes. Do you have the information on hand? If not, how do you find the information? What research methods are you going to use? Surveys, interviews, what data collection are you going to use? Are you going to use some sort of registration forms, intake forms, attendance, and all of that information? And when it comes to project management, You want to make sure too that you look at risk management. You want to minimize liability. So the first thing you want to do is maintain confidentiality of the records of people who are participating in your program, as well as the people who are responding to your survey. You also care about design, right? Because you want to make sure that you have the right tools or match the right tools for your outcome measurement. I've seen in some cases where people have measurements, but the measurements don't necessarily line up with their desired outcomes, and they could still miss the mark. In fact, it has happened to me before. That's why I'm so passionate about evaluation and making sure people understand to do the evaluation planning at the same time they're doing program planning. You want to also incorporate the evaluation planning into your program so that your program incorporates the data collection so it doesn't feel like a separate process and that you don't find yourself scrambling on the back end. And then your work plan, you want to make sure that you develop a realistic timeline and make sure that there's accountability. So you want to not only have timelines with deadlines, but you want to assign specific tasks to specific people. And then you also need to have a budget, all right? So you want to identify the cost for evaluation. So that might be the cost of hiring someone from the outside to actually do your evaluation, or it might include staff time. Because remember, as you have people collecting this data, the time that people are spending collecting the data is, time that they're spending on their program. So that should be included as well. And then you also want to make sure that you include a line item for every major component of the process. All right, so the major elements of evaluation planning, the first thing is the people, right? The stakeholders, the people who are impacted by the work. So this could be clients, this could be board, this could be staff, right? What information can they give you that's going to add value to the process? And then you want to, again, you should have already had the program logic model in place. But if you don't have it in place, um, this is a good time to have it so that next go round, you'll at least have a more evidence-based framework to start with. And then you want to determine what kind of evaluation you have. Is it going to be a process evaluation? Is it going to be an outcome evaluation? Why are we doing this? Is it just to impress the funder, right? Is it for management purposes? Is it so we can genuinely learn something new? Are we looking to increase our impact? Are we using it to determine whether or not we're going to continue a service? Also, part of the evaluation planning process is determining what data you're going to need to collect. So remember, we already identified the indicators, right? We identified ways that you're going to determine whether or not you're moving toward your goals and objectives. But in the event that you're going to need some data to support that, what data is it that you're going to need to support it, right? And how are you going to collect the data? Is the data being collected through pre and post tests? Is the data being collected, or are the data being collected through surveys? Are they being collected through interviews, etc.? You want to pilot test whatever collection method you have, because 9 times out of 10, you're going to create some form and you probably have forgotten to ask some question, or you might assume that it's easy to understand. Somebody who wasn't inside of your head can sample the form and they can tell you where things are not clear. And then you want to, after you get your collection down, you want to be able to collect those data and then interpret the data. So it's not just enough to have the data on hand, just to say you have collected it. You want to get behind the numbers and understand what the numbers are telling you and what the implications are for the next time you do this program if you do it again. And then you also too want to know, what are the limitations of the data that you collect, right? Everything, sometimes we get so bogged down in the data, right, that we forget about the reason why we start our programs in the first place, right? We want to also make sure that people are at the forefront, right? So you can use these evaluations to share lessons learned, to make informed decisions so the board can use it for board governance. Management can use it to make management decisions. You can all use it to determine next steps. And how do you communicate success? You can communicate success in a number of different ways. You can take some of the information from the evaluation to put it in your annual reports, put it in your reports to the board of directors. You can put it in your press releases. You can even use your evaluations to develop a scorecard, and that way you can do a report card, on a quarterly basis as to how you're doing. You can use the results to have status reports to your funders and regulators to post on websites. The you can communicate the results through video productions, articles, and other publications. You can be guests on podcasts, guests on radio shows to talk about the work that you're doing and the impact that you're doing. You can be guests at town hall meetings to share what you're doing in the community, and most importantly, share the impact of your work to the community. And I would suggest too, after your board and the people who are actually working on the programs, the very first people who should hear about the results should be people from the community. So often we do our evaluations and we communicate to funders, and yes, they're paying for the work, but we stop there at the funders. We need to communicate to the people who are using our services. We need to communicate to our neighbors what the impact of our work is. All right, so here is a sample evaluation plan. And again, you can do this any way you want, but here's a sample plan. You would have an introduction. You would talk about the program and the background, talk about some of the goals and the objectives that you wanted to achieve, some of the outcomes. Then you'll talk about the evaluation design and the methodology, talk about the data you collected, um, and what the data told you. So you talk about the analysis plan and then the results of the analysis, talk about the timeline, right? And then the budget and the appendices. All right, so all of this is in your evaluation plan. And quite frankly, once you do this plan, it makes it very, very, very simple to do your actual evaluation. So some of these same segments are going to be in your evaluation. So the evaluation plan is basically what your strategy or what your approach is going to be. And then once you get this information, you have probably about 90% of what you need to actually do your evaluation itself. All right, so my challenge to you is to try this at home. For those of you who are in the nonprofit Utopia community, we can set up office hours so we could talk about it. But I'd like to see you develop an evaluation plan, and we can have an office hour to talk about it. You can also review this video and you can share some of your thoughts in the community. All right, so for those of you who are still with me, I want to say thank you so much. Thank you so much for joining me. And if you have any questions, if you have any comments, please share. All right. Okay, Kiela is no longer with us. And when I say no longer with us, she she had to hop off. I just want to say hi, Kiela. I know you're going to be seeing this on the replay. All right, so thank you so much. I really appreciate your taking the time to stop by as usual, Kiela. Thank you so much. I hope you enjoy the replay. If you have any questions or comments, you know how to reach me. And for those of you who are still here, if you have any questions or comments, you can email me at ValerieFLeonard at nonprofitutopia.com. If you want to share in the chat, you can do that and I can respond after we're done. All right. So again, thank you so much for joining us. And I look forward to coming to you again when we actually talk more about performance management and how we can relate those to our strategic planning process and develop our balanced scorecard. All right. So without further ado, I am going to end this now. And thanks again. Take care. Bye bye.